We have a small fellowship of 6 total fellows, so 2 a year, and each fellow is able to tailor their fellowship experience to reach the goal for what they want to do as a hematology or oncology career.
It is this academic center, but it's a smaller program. There's definitely, that community feel to Vermont and our hospital in general. We really all get to know each other in a way that feels different than at a lot of other programs.
Every person who is part of the team is actually bringing a unique perspective that fits very well into the care that we are providing for a patient.
There is an ease of discussion between the fellows and the attendings. It's a very open environment where you're encouraged to do a lot of thinking on your own, but there is unwavering support of the fellows.
The main benefit that the fellow feels is that they're getting a lot of individualized attention. If you're working one-on-one with a faculty member in clinic, you're doing the same on the consult service. You don't have a lot of other learners that are, interfering with your exposure, and their education is our number one priority.
Our program is unique because we have exposure to both urban population and a lot of rural patients that we serve.
We're the only cancer center in all of Vermont, and also the majority of upstate New York. So all of those patients funnel through the University of Vermont.
We have a growing population from other places, such as there's a Somalian community here. In my case, I have patients from Congo and from South America that I've had the pleasure to treat. So because we're the biggest hospital in Vermont, we get to see the simplest anemia to more complicated rare leukemias or sarcomas that are not so typical.
As they move along in their fellowship, they become more and more comfortable, and by the time they reach their third-year fellow clinic, they feel very comfortable taking care of very sick patients, because in that clinic they see really difficult oncology and hematology patients that are very sick.
University of Vermont in general is very dedicated to promoting medical education for medical trainees at all levels, be that students, residents, or fellows.
You're able to engage in education and research that translates to the clinical care that you're offering the patient in your day-to-day clinic.
Our benign hematology is world-class. This is run by Dr. Mary Cushman, who's one of the top researchers in the world. While people may not have a specific interest in benign hematology, when you leave here, you will be very well versed in this.
We have a really comprehensive cancer genetics program, all the way from meeting with a genetic counselor to long-term, where we talk about screening and prevention strategies to either reduce their risk of cancer or detect it at an earlier and more treatable stage.
It prepared me to be a really successful faculty. I have a really good clinical base that I developed here, but at the same time also I had exposure to great researchers, people who are funded, people who are well known internationally in their field, and they are now my mentors, and they've guiding me on a very successful research or academic journey. And it's amazing how this place can prepare you for both at the same time.
There's amazingly talented faculty here and mentorship. The program is able to be flexible and offer and support each fellow's individual, unique interests. My interest was cancer genetics, and I was able to work with program leadership and administration, as well as my individual mentors within the department, to develop a formal cancer genetics track my third year of my fellowship. And it was that experience that really solidified for me, this is what I want to do with my career.
Our University of Vermont Cancer Center is growing, and we are getting a lot of grants. At the same time, there's a lot of emphasis on investigator-initiated trials, and I'm lucky to be a part of one of them. And hopefully, by the end of fellowship, or soon as I'm staying here, by the time I start my attending, I'll be able to start my investigator-initiated trial here.
A lot of our fellows are presenting at regional meetings like Northern New England Clinical Oncology Society meetings. We have a huge representation from UVM at annual ASH and ASCO meetings, and even some of our fellows have presented internationally.
Being able to use all of those pieces that have come to me through the last 10 or 15 years Through this institution, I feel like my impact as a physician has grown with me here at UVM, not only at the patient level, but all the way up through a population level. And that's really very special.
Picking a place for fellowship is not just about training, it's about life. You're gonna live 3 years in that place. And, 5 years later, we're still here. So we kind of made a guess that this is an area where we would actually be very happy to live. And this is a program where I can actually thrive.
Just the convenience of life is just so amazing here that your day-to-day is a lot easier and you can really focus on learning and growing as a medical professional.
As someone who didn't train here and came here as an attending, it feels very different than the places I've been.
Great reputation, great place to train. These people here became my friends and great colleagues. You really will find out that the people here, we're all close with each other. I don't think you can really experience that until you're here. And even through a virtual interview, I could sense that. And that's one of the things that exceeded my expectations.
There's a reason that a lot of our fellows decided to stay here on faculty because they loved it so much that they didn't want to go anywhere else.
I was always drawn back to the people and how supportive of an environment it is here, and then ultimately decided to stay here for residency and fellowship. It seemed so natural to stay here as faculty.
I did my fellowship here and I felt so comfortable working with all the people that I was surrounded by that I felt, okay, what better place to start your job than your own colleagues and mentors. I'm so happy that it worked out and look forward to the next step in our life here at UVM.